This is Dr. John Osborne, the Chief Medical Officer at ClearCardio. We're going to talk today about an incredibly important and incredibly relevant issue to about half of the population out there. The reason I say that is in the U.S., anyone over the age of 18 has a 50-50 chance of having high blood pressure. Having high blood pressure causes strokes. It is a leading cause of blindness, causes heart failure, can blow out your kidneys, and also contributes significantly to the formation of plaque in your blood vessels. So today we're going to be talking about high blood pressure. We're also going to talk about the insurance companies. So a very important topic. I think hopefully I've grabbed you. Let's talk about this condition that is generally silent. It is called the silent killer. Half of U.S. adults have this. Many of them don't even know they have it. Even those that do know they have it may be on appropriate therapies, which could be diet, exercise, medications. And even after all that, few of these patients know they have high blood pressure or on appropriate treatment for high blood pressure, and the blood pressure is controlled. In fact, your blood pressure can be barely elevated, and it's enough to disqualify you from life insurance, mortgage coverage, or even certain procedures or health insurance. Meanwhile, your doctor may be telling you it's not high enough to treat. See the disconnect? In the next few minutes, I want to walk you through what high blood pressure really does to your body, how insurance companies frankly exploit it, and why this one number has more power over your life and death than almost anything else. In fact, I love to tell people the most important thing that happens when you visit your healthcare provider is they check your blood pressure. That probably is the most useful, most important data that they're going to get when you go to visit your doctor. For decades, doctors didn't believe we needed to treat high blood pressure unless you had symptoms. We're talking headache, chest pain, vision changes. I'm going to tell you, if you have high blood pressure and you have those symptoms, you don't have high blood pressure. You have really, really dangerously high blood pressure. High blood pressure generally has no symptoms at all. By the time it causes symptoms, as I mentioned before, that's no longer high blood pressure. That is dangerously high blood pressure. In fact, in the past, we even called high blood pressure essential hypertension, which is medical code for we don't know what's causing it, so we're just going to live with it. In fact, it gets worse. Years ago, decades ago, that term was used, essential hypertension. And the reason that we called it essential hypertension is both a little funny but mostly really shocking. In the old days, 100 years ago, high blood pressure was seen as a very good thing because we knew that the vessels, as we got older, would get blocked up and clogged up. So the concept behind high blood pressure was you needed that high blood pressure because your vessels were blocked up, and you needed that high blood pressure, I'll call that pressure head, to force the blood down those blocked up blood vessels. So that blood pressure was not bad, it was essential. So that's where we got the terribly misleading term of essential hypertension. Later, we kind of morphed that term into essential, meaning, well, we don't know really why you have it. But it really started with the genesis over 100 years ago that high blood pressure was seen as a good thing. In fact, there's still a myth, I still hear it repeated even now in the 21st century, that for every decade, your blood pressure, the top number, should go up or can go up 10 points for every decade of life. That is 100% absolutely a dangerous myth about high blood pressure. For high blood pressure, it doesn't matter if you're male, female, it doesn't matter which age, it is an equal opportunity killer. By the way, for the record, normal blood pressure, whether treated or untreated, is below 120/80. In fact, the most recent data, and we have lots of studies that show this, if you compare what we thought was high blood pressure, 140/90, and we had that number as the definition for high blood pressure literally for decades. Well, that number was wrong. That was in the guidelines up until 2017. In 2017, new guidelines came out based on 20 years worth of data that shows the harm does not begin at 140/90. The harm begins even lower at 130/80. Plus, we also underscored the fact that optimal blood pressure to keep you free of heart disease, kidney disease, strokes. Also, there's a very powerful relationship between high blood pressure and dementia as well, that optimal blood pressure is below 120 over 80. So if you want to keep one number in mind, 120 over 80, if it's persistently above 130 over 80, the guidelines say that needs to be treated, whether it's diet, exercise, watching salt intake, etc. It should be treated, and if those things do not work, medication should be used, because there is no reason why anyone should blow out their kidneys, go into kidney failure, go blind, have a stroke, go into heart failure in the setting of all of the different tools we have to very, very effectively treat high blood pressure in the 21st century. So literally for decades, there was no action, there was no urgency. It wasn't even until the late 1960s when VA administration studies finally proved that treating high blood pressure saves lives. But it still took decades for the medical establishment, and even longer for insurance, to say, let's talk about high blood pressure and what it actually does inside your body. First of all, it puts constant force on the artery walls. It damages the inner lining of the vessel, called the endothelium, that is critical for your health. That endothelium, literally a single lining of the blood vessels, a single cell lining of the blood vessels, coats all of our blood vessels and plays an incredibly important role, acting, as I like to say, as the Teflon, as one of my colleagues says, the slippery slide that prevents plaque from building up and ultimately heart attacks and strokes due to plaque. All of this then causes and triggers inflammation and ultimately plaque formation. And over time, the rupture of that plaque is ultimately what causes heart attacks and strokes. You may feel fine. Odds are you do. Most people with high blood pressure feel perfectly normal. But the real damage is occurring in silence every single minute your blood pressure is elevated. And here's the killer stat, pun intended. Over 75% of the time, heart attack patients had high blood pressure. That is, 75% of first-time heart attack patients had high blood pressure. So having high blood pressure is a very significant, we use the term biomarker, but a significant marker for your risk of having a heart attack. High blood pressure is the number one modifiable risk factor for stroke. Strokes are intimately related to high blood pressure. It is also a leading cause of kidney failure. If you lump together high blood pressure and diabetes together, one or the other, and certainly both, that is by far the vast majority of people that go on to develop kidney failure, kidney disease, and go on dialysis, which is a really, really, it is life-saving, but is a really, really tough life. Or even if you get a transplant, which is a miracle of modern science, that is certainly a better solution than dialysis. Not everyone's going to be eligible for that, but also encompasses a lot of other medical problems and complications as well. So now let's talk about insurance and how they weaponize blood pressure to protect their profits, not your health. Apply for life insurance. Your systolic blood pressure is over 140, you're high risk. Premium goes up, or even you're denied. Apply for long-term care insurance. Same thing, elevated blood pressure, denied. Try to get coverage for certain diagnostic tests or medications. If your blood pressure isn't high enough, they say it's not medically necessary. And here's the kicker. They'll deny proactive care because it's not approved under your current condition. But the moment you have a stroke or heart attack, they'll pay for the ambulance, the ICU, the surgery, all of that stuff, the stents, the balloons, all of that stuff. That is not health care, it's disease management, and only once you're expensive enough. So you're stuck in a catch-22. You don't qualify for better insurance because your blood pressure is elevated. But if your doctor might tell you it's not high enough to treat, let's just keep an eye on it. Meanwhile, the damage is happening to your arteries, to your brain, to your kidneys. This is why ClearCardio exists, to get you out of that deadly trap. We don't wait for a crisis. We look at your numbers and the context behind them. Because one person's blood pressure of 130 over 85 may be fine, but for someone else with inflammation, genetic risk, other factors, they may have early plaque, and that is a ticking time bomb. I've spent my career in this space, not just reacting to disease, but most importantly, as I see it, preventing it. I am board certified in a whole variety of specialties and subspecialties, including cardiology, internal medicine, clinical hypertension, lipidology, cardiac CT angiography, echocardiography, and nuclear cardiology. And I say that not because I'm boasting, but those are the things that I realized I needed to be the most prepared, most knowledgeable, most experienced person in the preventative cardiology space. Along the way towards this passion of being the best preventative cardiologist, I got my MD, magna cum laude, as well as a PhD in cardiovascular physiology. My postdoc research at Harvard Medical School focused on vascular inflammation and atherosclerosis with the exact mechanism by which high blood pressure accelerates. I've testified before Congress, written policy papers, and helped design systems to improve cardiovascular outcomes. So when I tell you this system isn't built to protect you, I've seen it from the inside. At ClearCardio, we don't wait for permission from insurance. We go straight to the root cause. We run advanced labs and blood pressure diagnostics. We use cardiac CTA scans to see the plaque that you cannot feel. We build a year-long plan to reduce your risk and track your progress, not just watch numbers. Because you deserve better than waiting until your stroke is bad enough for you to qualify for help. You deserve to know what's happening inside your body before it becomes a crisis. If you've been told your blood pressure is a little high, but not bad enough to treat, I want you to take that as a red flag. Join our ClearCardio community. We'll send you science-backed insights, patient stories, monthly live Q&As. We'll send you science-backed insights, patient stories, and monthly live Q&As so you're never in the dark about your risk. Join us today at www.clearcardio.com/newsletter. You don't need to wait for the insurance. You don't need to wait for symptoms. You need a plan, and we're here to help.